The way Parkinson's disease is diagnosed is a clinical diagnosis, by which I mean that the physician usually takes a history and performs an examination. We usually don't do any tests such as a brain scan, like an MRI of the brain, unless there is a certain reason that the physician feels like an MRI is needed to make an assessment that they have features of Parkinsonism. A patient has to have at least 2 out of these 3 to be present: tremor, slowness or bradykinesia, or rigidity. Once that is established, a physician usually assesses that there are not any other reasons or other neurological findings. In addition, the physician usually will assess that the presentation is not atypical, by which I mean that the symptoms did not begin with an atypical symptom such as falling. Finally, we look at certain other characteristics, such as, did the symptoms begin on one side? Did the patient have a tremor when they were just resting, which is called a resting tremor? A resting tremor starting on one side is the most common presentation for Parkinson's disease. We often assess, have the symptoms progressed over time? We assess if they have been on medications, that not only they have responded well to the medications, but if a patient has developed any involuntary movements due to their medications. Taking all this together, a physician will come to a clinical diagnosis of Parkinson's disease.